So far, we are approaching to the last presentation. It's my really pleasure to introduce XinlingZhang, Professor and Deputy Director of Ultrasound Department, Chief Physician, Doctor, Postdoctoral Supervisor at the third affiliated hospital of Sun Yat-sen University. Sorry if my pronunciation sometimes is not really good. I will try to improve, and I hope you could teach me when we will meet in China or elsewhere in the world. She is also a member of the Obstetric and Gynecology Special Committee of Ultrasound Branch of Chinese Medical Association, member of Standing Committee of Ultrasound Branch of Chinese Medical Doctor Association, Director of Obstetrics and Gynecology Branch of Chinese Society of Ultrasonic Medical Engineering. She is very active in promoting clinical application, new technology in gynecology and obstetrics. Therefore, it's my pleasure to let her talk about the application in differential diagnosis of complex gynecology masses. Please, Professor XinlingZhang.
Good morning, everyone. It's my pleasure to give a lecture online. Today, we'll talk about application of contrast-enhanced ultrasound in differential diagnosis of complex gynecological disease. First, I will give a brief introduction about the reason why we need CEUS in gynecological disease, and then I will show some examples to illustrate its use. At last, give a short summary. Why we need CEUS? As the previous lecture had said, we need to assess the agent perfusion of the mass in order to give a more accurate diagnosis. The mass with or without agent perfusion is a great important question, and a color Doppler can't always answer the questions. Then, how to perform the CEUS? The preparation and method are the same as in other organs. Sonoview is injected intravenously into the body. The dose, here shows the doses. The doses of transabdominal CEUS is different from that of the transvaginal CEUS. The dose of transabdominal CEUS is smaller than the transvaginal CEUS. Then, what should we focus on? Instead of the time intensity curve, here shows this is a quantitative analysis. The qualitative indicators can also provide a lot of information and were more convenient. We should focus on the features such as the arrival time, signal intensity, the phase of enhancement and washout, and the distribution of the agent inside the masses. For gynecological disease, the reference is the normal myometrium. Here showed the features of the qualitative performance. So we should learn about the CEUS image of normal uterus firstly. From the imaging, here showed the transabdominal CEUS. From the imaging, we found that the sonoview reaches the myometrium first, and then gradually spreads to the endometrium. At the same time, we found the signal intensity of the myometrium is higher than that of the endometrium. The agent is evenly distributed in both endometrium and the myometrium. Here is the transvaginal CEUS, showed the same process as transabdominal CEUS. And here is the features. Then, when we need CEUS, when we encounter complex cases, I will show you some examples. Question 1. When the patient has the symptom of vaginal bleeding, ultrasonography showed thickened endometrium. How to distinguish between the benign from the malignant endometrium? Just like these two females, they had the same symptom and the similar B-mode imaging. Case A is a 48-year-old woman with vaginal bleeding for 1 month, and case B is a 41-year-old woman with vaginal bleeding for 6 months. And then, how to distinguish A from B, which is hyperplasia and which is cancer, or both of them are hyperplasia. So let's we see the CEUS, and now we can clearly find that in case A, the arrival time of the lesion is almost synchronized with that of the myometrium and is vastly earlier than the rest of the endometrium. And case B, the enhancement mode is similar to the normal uterus. First, the agent arrived at the myometrium and then gradually spread into the endometrium. The signal intensity is lower of the endometrium is lower than the myometrium. So it gives us more confidence to confirm our diagnosis. The pathological result confirmed our diagnosis, and case A is a typical hyperplasia and no invasion of myometrium, and case B is a simple hyperplasia of endometrium. Thus, when the above features appear, such as the arrival time is faster than or simultaneous with the myometrium, or the signal intensity is hyper enhancement, or with heterogeneous distribution of the agent, we should consider the possibility of the endometrial carcinoma. Here is a typical endometrial carcinoma. Let's review again. The arrival time of the lesion here shows that arrival time almost synchronized with the myometrium, and the signal intensity was also the same as the myometrium, is also the insul enhancement. And here is the typical endometrial carcinoma. And then, in clinical practice, except for the endometrial carcinoma, cervical cancer is another common malignant tumor of the uterus. There will always be non-occupied lesion was found in patient with vaginal bleeding untouched or after intercourse, just like these two cases. Case C is a 28-year-old woman with vaginal bleeding for 2 months. HPV was positive. And case D is a 45-year-old woman with vaginal bleeding untouched for 2 months. In case C, we found a hyper-enhancement tumor in the cervix, and the agent arrived time of tumor area is earlier than that of the myometrium and the rest of the cervical area. And how about case D? We can still find the agent arrived time of cervix is earlier than that of the myometrium. The difference is the whole cervix shows the same enhancement mode without any occupying lesion. What's more, the peak signal intensity of the cervix was the same as the myometrium. Pathology confirmed again the CEUS findings, and case C is a cervical cancer with stage 1, and case D is a high-grade squamous intraepithelial lesion. However, the published study suggested that CEUS can help to find out the lesion larger than stage 1B, but show no benefit in diagnosing stage 1A. Here showed a typical cervical cancer. Please remember the CEUS imaging of it, and I will show you. Here shows the agent perfusion of the lesion was earlier than the myometrium, and the signal intensity is higher. And here the washout time is also earlier than the myometrium. Please remember the typical cervical cancer. When it comes to adnexomas, CEUS help us classify whether or not has the agent perfusion in the solid part of the masses. Like these two cases, with cystic solid mass located on the left side of the uterus. Here, and this one, and this one. Images show that the solid part without or with a little bit color signal. And how about CEUS? Here showed the CEUS imaging here. Let's see case F. The CEUS shows that the agent perfusion of the solid part in case F was hyper-enhancement, which was confirmed as a borderline serous cystoadenoma. How about case E? Let's see. Case E was no enhancement. Here was no enhancement in the solid part, and the pathological result is hematoma. Overall, the guideline of CEUS in non-hepatic applications had showed the usefulness of CEUS. CEUS can provide more information to diagnosis gynecological masses in complex clinical practice. As the guideline had partially admitted its value in diagnosis of gynecological mass, but more study is needed. That's all. Thank you.
Excellent presentation. the good update on what we can do by means of CEUS in this field. I have a question from the audience for you. Is there any difference in the menstruation cycle? And should the examination be performed at a specific time point? Could you please clarify?
In my opinion, we can do the CEUS examination during any phase. Yes, don't be limited to the menstruation cycle, because we found that the agent perfusion is similar during such as the early phase or late phase of the menstrual cycle. It's no difference between the type. It's no difference. We can perform the not choose a time point. Is at any phase of the menstrual cycle.
Okay, excellent.
Okay.
Is there another question? Do you use injecting contrast at 90 or 108 degrees?
90?
90 or 180 degrees?
Maybe as no. Yes, I get it. Maybe 90 degree, not
perpendicular. Yes.
Yes.
Yeah, I can add something also to my point of view. If you have the double wire, this is incorrect. This is correct. So you have to do parallelly to the main line. This is in order to avoid disruption of microbubble. Thank you so much. Let me really thank the three speakers. Let me thank Bracco. As EFSUMB representative, I'm proud that we are continuing this kind of cooperation. And I'm very proud to have launched the webinar some years ago. One hand to all of you. Have a good night. I hope to see you soon somewhere. Next Eurozone, RSNA, WFUMB, Chinese event. I'm very happy to continue to work with all of you. And I'm very proud, thankful for the knowledge that you increased and you added today to everybody. I wish you a good night. See you soon. Ciao.
And thank you, and have a good night.
Thank you, thank you. And for the registrants, everything is recorded and will be available very soon in our website. In this case, also the other people who cannot follow this very interesting webinar can have the chance to learn more. Again, ciao.
Thank you.
Thank you for this opportunity. See you.